Salam sejahtera Puan Adiba. We are Group 1 from ODL Cohort 4. We are here to present the topic Inhalant Use Disorder. The contents of our presentation will include the definition of inhalant use disorder, clinical manifestations, the complications associated with it, the treatments for inhalant use disorder, as well as the nursing care plan.
Hi, my name is Geriatrics-NBNS3563. For the definition, inhalant use disorder are a group of disorder consisting of inhalant intoxication and inhalant use disorder that pertain to the inhalation of glue, paint, lighter fluid or other substances such as chemicals or volatile hydrocarbon to create a high. Inhalants are often inhaled through the mouth, huffing, sniffed or snorted by the nose. The high feeling felt by user generally lasts only a few minutes. Although inhalant addiction is uncommon, inhalant exposure can have long-term repercussions since chemicals linger in the body, potentially causing harm to the kidneys and liver as well as nerve fiber and brain cell. Example of usual use inhalant for the first is solvent, industrial or household product including paint thinner or remover, dry cleaning fluids, gasoline, lighter fluid. Art or office supply solvent including correction fluids, felt tip marker fluid, electronic contact cleaner, and glue. For the nitrate, this is often sold in small brown bottle labeled as video head cleaner, room odorizer, leather cleaner, and liquid aroma. For the gases, found in household or commercial product including butane lighter, propane tank, whipped cream, aerosol, or dispenser. The last one, used as anesthesia to make patient lose sensation during surgery procedure as anesthesia, including ether, chloroform, nitrous oxide. Next, I will pass to my colleague for the next slide.
I will present about the clinical manifestations. Inhalant abuse can have various clinical manifestations. These include dizziness, nausea, slurred speech, lack of coordination, hallucinations, irritability. Long-term abuse can also cause damage to the brain, liver, kidneys, and other organs, as well as neurological and psychological issues. In severe cases, it can lead to seizures, coma, or even death due to oxygen deprivation. It is important to seek immediate medical help if inhalant abuse is suspected.
Hi, I'm Aida. So I'm going to present regarding the complication of the inhalant use disorder. So for the first one, they will infect to the neurological. They cause the brain damage because of the repeatedly using inhalant for the extended period that can harm to the CNS system, which can cause memory loss, cognitive impairment, and issue with staying focused due to the cerebral edema. Other than that, peripheral neuropathy also caused by some inhalant that damage to the peripheral nerve and lead to the tingling, numbness, or weakness in the extremities. Second, they will infect the respiratory system. The respiratory depression. Inhalant can suppress the respiratory system, lead to the slower breathing, and also decrease the oxygen supply to the body and cause acute respiratory arrest. Bronchospasm is caused by chronic inhalant that use may result in the bronchospasm, contributing to the respiratory difficulty and exacerbating pre-existing respiratory condition. Third, cardiovascular effect. They may cause inhalant that may cause to the irregular heart rhythm, which is arrhythmia, and also increase the risk of the cardiovascular complication. Some inhalant may increase the blood pressure that causing the hypertension because of they putting the additional stress on the cardiovascular system. The fourth one, they affect the liver and kidney may cause damage due to the certain toxic substance in the inhalant may cause damage to the liver and kidney over the time. Other than that, psychological and behavioral issues also affect. So in the psychosis, due to the prolonged use of inhalant may contribute to the development of the psychotic symptoms such as hallucination and delusion. Impaired judgment. Inhalant use can impair the cognitive function and decision making, which can increase the risk of the accident and risky behavior. Next, they will also effect on the gastrointestinal effect, which may cause nausea and vomiting. Some inhalant can irritate the gastrointestinal tract, lead to the nausea and vomiting. Also may cause weight loss due to the chronic inhalant use may contribute to the weight loss and malnutrition. Last one, muscular skeletal complication. The muscle become weakness and atrophy. Due to the chronic inhalant, it may result in the muscle weakness and atrophy, contribute to the motor coordination and difficulty. So from the slide here that show that inhaler may cause a very harmful effect to our body from the brain until the bone. So from the brain, they may cause the permanent brain damage, memory loss, hearing loss, nose bleeding, loss of smell, slurred speech, suffocation, sudden death, irregular heartbeat, heart attack and death, vomiting and nausea, and also infect to the kidney and the liver damage, muscle weakness and cramping, abdomen pain, and also involuntary passing of the urine and feces, and lastly, bone marrow depression.
Hi, my name is Nurfara Wahida. So I'll be presenting about the treatment approaches. So among them, we have 4 types of approaching treatment that we can use for this problem. Number 1 is medical detoxification, which is supervised withdrawal to manage symptoms and ensure safety. Number 2 is behavioral therapies, cognitive behavioral therapy to address underlying issues and promote change. Number 3 is pharmacotherapy, which is medications to alleviate withdrawal symptoms and prevent relapse. Lastly is supportive counseling, which is emotional support and guidance through the required process. So for the behavioral, we have 2 types of management, which is number 1, cognitive behavioral therapy or CBT. This is to identify and modify unhealthy thought patterns and behaviors, and also to develop coping strategies to manage triggers. Number 2 is contingency management, which includes positive reinforcement for desired behaviors and abstinence, also incentive to encourage engagement in treatment. So for the pharmacotherapy approaches, which is medications, is to address withdrawal symptoms and craving. So for example, naltrexone, acamprosate, or disulfiram may be considered to this kind of problems. And also collaboration with the healthcare providers is also important to do a consultation with a physician for medication management. Usually we will consult a mental health physician.
Hi, I'm Arina. Next, we continue with supportive counseling. We have 2 types, for individual and for the group. For the individual, we have tailored session to address personal challenges and goals. And for the group, we provide peer support and share experiences, fosters a sense of community and understanding. Next is a holistic approaches, which is mindfulness and meditation. It is to reduce the stress and enhance self-awareness, exercise and nutrition. As what we know, physical well-being as a component of overall health, and family therapy. We also get involvement of family in the recovery process. The last one is a collaborative care, which is included multidisciplinary team. We get involvement of psychiatrists, psychologists, nurses, and other healthcare professionals to help those people, and communication and coordination to ensure seamless care transition and comprehensive treatment. Thank you.
Hi, Assalamualaikum. My name is Fazlin. I will presenting my part, which is nursing care plan. Okay, firstly for the nursing assessment of a patient with substance abuse disorder includes first, history. Patient with other family members with substance abuse problem may report a chaotic family life. And then the second one, thought process and content. During the assessment of thought process and content, patients are likely to minimize their substance abuse, blame others for their problem, and rationalize their behavior. And then the third one, sensorium and intellectual process. Patients generally are oriented and alert unless they are experiencing lingering effect of the withdrawal. And then the fourth one is a general appearance and motor behavior. Assessment of the general appearance and behaviors usually reveals appearance and speech to be normal. And then the last one, self-concept. Patients generally have a low self-esteem and are covered with strange behavior. So for the first nursing diagnosis is accepting reality related to responsibility for their behavior. For the expected outcome, the patient will verbalize awareness of the relationship between substance abuse and the current situation. Second expected outcome, the patient will admit the inability to control their drug habit and surrender to the powerlessness over the addiction. For the nursing intervention, identify how the patient preferred to be addressed. The rationale is this show courtesy and respect, giving the patient a sense of orientation and control by using their preferred name. The nurse shows acknowledgement of their individuality and identity with their diagnosis. Also, using a patient's name can help establish trust and rapport. Second one is respond to inquiries truthfully and provide accurate information. The rationale is this create trust, which is the basic of the therapeutic relationship. Honesty and transparency are crucial in building the trust. The nurse should be honest about what the treatment process entails and what the patient can expect. The third one, determine the purpose of the commencing sensation and therapy to the patient. The rationale is this provides insight into the patient's willingness to commit to long-term behavior change and believe that he or she can change. So the fourth nursing intervention convey an attitude of the acceptance, separating an individual from unacceptable behavior. The rationale is this promote willingness of the dignity and self-worth. Patient may experience stigma, shame, and guilt. An attitude of acceptance help reduce this negative feeling. For the last nursing intervention, examine the terms drug relaying and its numerous types of manifestation such as usage pattern, implement, induced by use, respond to the substance. The rationale is this information helps patient make decision regarding acceptance of problem and treatment of choice. Effectiveness education on the treatment of the substance use disorder among the healthcare team can help to improve outcome. For this nursing diagnosis, the evaluation is the patient will be able to express feeling openly and directly. And then the patient will be able to verbalize acceptance of the responsibility for his or her behavior. And the patient will be able to practice non-chemical alternative to deal with the stress or the difficult situation. And the last one, the patient will be able to establish an effective aftercare plan.
Hi, I'm Sazwati Saad. I will continue with second nursing diagnosis, ineffective coping related to negative role modeling. Expected outcome, the patient will recognize instances that cause increased stress and a desire to use substance, and then the patient will use appropriate coping and problem-solving skills in place of substance use. Nursing intervention, First, assess the patient history of substance use. Rational, patient with substance abuse may be able to recognize instances throughout their life that trigger substance use. This can aid in learning to recognize triggers. Number two, assess family role modeling of coping through substance use. Patients whose parents, friends, or guardians struggle with substance abuse may affect how the patient learns to cope. Substance use has been shown to have a genetic component. Number three, set limits and confront the patient's effort in making excuses. Patients suffering from substance abuse tend to exhibit manipulative behavior to get what they want. Number four, encourage the patient to verbalize fears, feelings, and anxiety. This enables a trusting relationship that will help the patient come to terms with unresolved or unconscious problems in life that contribute to substance abuse. Number five, explore alternative coping strategies with the patient. The patient may have limited knowledge of appropriate ways to respond to stress. Providing alternative coping strategies will help the patient. Number six, assist in relaxation techniques, visualizations, and diversions. This allows the patient to relax and develop new ways to deal with problems and stress. Diversional therapies and activities are useful in coping mechanism. For evaluation, first, the patient will recognize instances that cause increased stress and a desire to use substance. Number two, the patient will use appropriate coping and problem-solving skills in place of substance use. That's all from our group 1. Thank you very much.
Okay, here are our team members, and thank you.